Thank you very much, Dr. Serni, for that talk. Next, I would like to call Dr. Fong Si Lei, neurologist and general physician from University of Malaya Medical Center, and she will be giving her talk on epilepsy and COVID-19. Let's welcome her to the spotlight.
Hi everyone, I'm Dr. Fong here. So just give me a minute to share my screen. Share my desktop. Okay, so I think Dr. Sherini has given a very comprehensive talk just now about what is epilepsy. And the other important point that she mentioned in her talk is also how do we usually differentiate seizures and epilepsy as well. So, so following the talk, I think we actually ought to talk about something that it's very up to date, something that has been going on since, for us at least Malaysia, since early 2020. Okay, no. All right. Something has been going on since the early 2020, but actually, this thing is actually still in a way quite new to us because it's a pandemic that never really happens before in globally. All right. So I'm Dr. Fong. I'm a neurologist from University of Malaya Medical Center. I actually just joined the society less than a year time. So thank you for the organizer from giving me a chance to give a talk in this the epilepsy awareness talk today. Okay, so I'm sure you guys get updates every day now from your My Sejahtera application about how many new cases, how are we doing with the COVID cases in Malaysia now. So back in 2020 in March, when it first started in Malaysia, we were actually very panicky about this COVID-19. So even 1 or 2 cases make everybody very jittery about how is it going to spread in whole Malaysia? Should we go on a full lockdown to stop the spread of the infections? But looking back at how we actually has lived with this infection for the past 2 years now, actually up to yesterday, even with 28,000 new cases, we were actually pretty much almost back to our daily activities. We can actually buy now, we can go shopping, we can go and buy our groceries outside. Right. So with this COVID-19 on board, we also actually want to know how much this thing has impact on our patients with epilepsy. Okay, so of course, when we talk about disease and also a pandemic, the number one thing that comes to our mind as a doctor is always how that infection affects the epilepsy care of that patient. How will they get their follow-ups done? How will they come and pick up their medications? How, if they have emergency, where to go and what to do at home? And not only that, so we felt that there is a change in the way we care for epilepsy patients during the pandemic. And because of this MCO after MCO, PKP after PKP, we restrict people movements from here interstate or intrastate also. So to a certain degree, it actually affects the mental health of, I think, not only people with epilepsy, or even if you do not have epilepsy, your mental health would actually be affected to a certain extent. And when the vaccine comes in, so there are a lot of questions as in whether or not it's safe for us, whether or not it's also safe for our patients with epilepsy. That is also something that actually raised a lot of doubts in our patients. And of course, right. My slides got stuck a bit, right? Okay. My slides are not moving. Wait, just let me go ahead. All right. So as how it has actually affected the educations of our general population, and even on people with epilepsy, also with their disease on board, to a certain extent, it also has affected the progress of their education in these 2 years. And just to give you an idea, our student actually did a study based on our patients population, and also some actually from the society who are not patients from our hospital. So how has it actually affected our patients since then? We have 13% of our people with epilepsy who experience seizure worsening during this pandemic. And you may actually think that 13% is not a lot, but to have a pandemic affected how the seizure control is, I guess even 1% for us is considered a very significant number. So what are the things that actually makes their seizure worse? So we found that especially those who have a very poor seizure, who usually has very poor seizure control, those who have someone like, at least once per month, they tend to have a lot more seizures during the pandemic. And also those who are usually has very difficult to control epilepsy, especially in a way, usually they are on 3 or more medications. And also those who has a lot of worries of whether or not the seizures are going to worsen. So that anxiety actually causes them to have difficulty in sleeping, to have a lot of stress going on. So all these can actually make a person who already has epilepsy gets seizure more frequently. And also those who actually has got logistic issues, those who have difficulty in their transports. Okay, I'm not sure why there are people drawing on my screen. Never mind. So those who actually have difficulty in attending the emergency units actually tends to have their seizure worse during the pandemic. And we also noticed that those who actually ran out of medication. So this is actually quite a clear-cut cause. So when the MCO comes into picture, they can't go out to collect their medication. They can't come to hospital to follow up. So when they ran out of the medication, so that's when their seizure worsened. And also even if they actually got a date to come to the hospital sometimes. So during the beginning of this pandemic, we are so scared to be exposed to the public, to expose to people who might actually be infected with COVID around them. So you will avoid people, you avoid going to public places. And also hospitals is always very crowded. So this is also one of the reasons why they actually ran out of medications, and then they get the seizures that is worsened. And of course, as mentioned just now, if they have a lot of worries about losing their jobs, when this pandemic is going to go away and sort of thing. So this is actually one of the reasons why their seizures actually worsen. And we also found out, especially those who have worse seizures, there are more seizures during the pandemic, actually up to 8% who has anxiety, and also 6% of them actually has depression, which is all because of this COVID pandemic. So if we actually look back on all the causes on why they have worsening of seizures, it's all distinct. It's because at the very beginning, not only the patients has a lot of worries, not only the general population has a lot of doubts about how this infection is going to go, how much will it affect our life. Even for our healthcare services as well, we need to adjust a lot of things to make way to provide a safe environment for the patient to come to seek for their needs, their healthcare needs, and also at the same time do not compromise the care that we actually give to them. So this falls into how much do we understand about how this COVID-19 infection can actually affect the epilepsy. So this will be the first half of the talk, and then the second half I'll be talking about mainly about this vaccine related issues in epilepsy patients. Okay, how do I get rid of this thing? Okay, anyway, so this the points that I'll be talking about in the first half of this talk when about COVID-19 infections and epilepsy. I'll be talking about things like does having epilepsy considered a risk factor for COVID-19 infections, and are people with epilepsy are at higher risk for complications from COVID-19 infection should they actually get it. And can COVID-19 infection cause seizures? Can a seizure get worse in people who are with epilepsy who's infected with COVID-19? And also, if they are on anti-seizure medication and they are also infected with COVID-19, and if the doctor wanted to prescribe some medication for COVID-19, will that cause any problem? Okay, so I'll be doing in a Q&A presentation, so it's easier for you to understand what I'm talking about. So is epilepsy considered a high risk factor for COVID-19 infection? Well, absolutely no. Okay, by now, 2 years into this pandemic, we all know that there are certain populations who are at high risk. We always talk about patients, people with comorbidities, patients with long-standing illness, penyakit chronic, are those who are at high risk of COVID-19 infection. So yes, penyakit sawan actually is a form of penyakit chronic also, but epilepsy itself do not pose a higher risk for people to get COVID-19 infection. So having epilepsy alone, basically you're like any other general population. There stands equal chance if you don't take precautions or standard precautions like, wearing a mask, washing our hands frequently, sort of thing, you're actually at equal chance of getting the infection. Right. Okay, and are people with epilepsy at higher risk of complications from COVID-19 infection? So epilepsy itself, again, do not put them at higher risk of COVID-19 infection, and it also do not pose a higher risk of getting complications from COVID-19 should these patients be infected with COVID-19 infection. But if the epilepsy itself comes with other health conditions, or the patient with epilepsy is also having another health condition, and the treatment that they're actually taking for that particular health condition, which may reduce the immunity, that actually can put them at higher risk from suffering from more severe complications should they be infected with COVID-19 infection. Okay, so what are the things that can actually increase their risk of getting severe complications from COVID-19? We have medication-related risks, okay, especially talking about those therapies that the patient is taking that can make the immune system weaker. All right, so anti-seizure medications are medication that we give to patients with epilepsy to reduce the risk to get in getting seizures. Those medications has nothing to do with immunity. Okay, they do not weaken the immune system. Therefore, it shouldn't increase a patient's risk of getting severe complications from COVID-19 if should they actually be infected with this infection. Okay. And of course, if they do have, if the epilepsy actually comes with other neurological conditions, or some developmental issues that can affect immune system, then it can actually cause higher risk of developing more severe complications should they be infected. But again, all these things has to, the associated conditions or the medication that the patient is on has always to have something to do with the immune system, all right, for it to actually cause the person to have higher complications, to get higher complications from COVID-19. And I guess by now, you guys are actually not very familiar or already very familiar with what are those risk factors that we talk about when we say, oh, you are high risk of getting complications from COVID-19. So the top on the list is always diabetes, things like obesity, and also chronic diseases. Now, these are the chronic diseases that I meant. You can have a lung problems, you can have a heart problems, you can have kidney problems. Again, but having epilepsy itself is not a comorbidity that will increase the risk of getting COVID-19 or complications from COVID-19. But if patients with epilepsy are not at higher risk of getting the infection, okay, so if they do not have epilepsy to begin with, the question now is, can the COVID-19 infection actually cause seizure? Can they cause sawan? All right, so the answer is yes. But I need to remind you about what we have actually learned from Dr. Sharini's talk just now. What are the differences between a sawan, a seizure, and also a penyakit sawan? So a seizure is just something that you have at that moment, acutely, at that occasions when you are not well. But if you have the cause of the seizure that is something that cannot be removed, you will have continuous risk of getting seizures again and again and again. Then you're considered to have penyakit sawan, or what we call as epilepsy. Now, how does this COVID-19 infection has anything to do with seizure? Okay, so up till now, we actually do not have a very solid evidence to say that the COVID virus can actually go into a person's brain, okay, and then it causes infection in the brain directly, and then it causes sawan. All right, we do not have such evidence now, right? So the only way if you're infected with COVID-19 and you get seizure is through many other indirect ways. Okay, so you get infections, COVID-19 infection, you get something else, and that something else actually causes seizure. So what are there something else that I'm talking about? So let's say you have got very severe infections in the lungs, all right? So the person has difficulty in breathing, okay, susah nafas. So when you have susah nafas, what happens is that you have problems with delivering oxygen to your brain. Okay, so it's because the lungs is where the oxygen goes into, and it actually, the lungs will actually distribute the oxygen throughout the blood to all the organs in the body. So when you do not have enough oxygen, so that is the reason why you get seizure. Okay, or when the infection is so severe that it's actually causing multiple organs in the body to fail during the very bad infection. For example, the kidney goes down, the heart function goes down, all right? So all these things can actually cause seizure as well. So just give you an example. So in very severe or very serious COVID-19 infections, a person gets kidney failure. So in kidney failure, the toxins level will go up. So this is also, when the toxin level goes up, it can actually cause seizure as well. All right. But the reason the seizure is not because of the COVID-19 infection, is directly related to, in this scenario, this is because of the kidney toxin that is building up, that is resulting in, that's causing the seizure. Or it can also be because of some metabolic issues. For example, the salt level is too low or the salt level is too high. So all these things can actually cause seizure as well. Or the patient with very bad COVID-19 infection is given some form of medication, all right? For example, medication to put them into sleep because of difficulty in breathing. So while the patient with COVID-19, serious COVID-19 infection is breathing through a machine, usually will put them into sleep as well. But somehow all these medications carries a little bit risk on causing seizures. So that may be one of the reasons why they actually cause seizures. Bear in mind that all the effects are actually indirect. Okay, so just let's say that a person with epilepsy really gets infected with COVID-19. So by now, I actually encounter quite a few of my patients who comes into clinic will tell me that, oh, last 2 months I get a COVID-19 infection, self-isolated and sort of thing. Okay, so can the seizure get worse? Of course, yes. But again, the effect is actually not direct. It's not because the COVID-19 virus caused the seizure to worsen in the people with epilepsy, but it's again, maybe something, for example, related to the symptoms. When you have COVID-19 infection, you get things like fever, all right? So fever itself increases the risk of getting seizures in patients with epilepsy, all right? And of course, all other factors that I have mentioned before in the slides. You've got very severe COVID-19 infections, your toxins build up, you don't have enough oxygens. All these are causes that can actually worsen seizures in a patient who already has epilepsy. Okay? And what if a patient who has epilepsy gets infected and the doctor wants to start them on some medication to treat the COVID-19 infection? Are we worried about this medication of, worsening the medication that the epilepsy patient is taking? we are not too concerned about this. Okay, at the beginning of this pandemic, you know, there are a lot of trial and error, and sort of we use this medication A to treat this disease, see whether it's better, then we try medication B, sort of thing. So by now, at the beginning of the pandemic, we actually used to use this hydroxychloroquine. I'm not sure whether you guys actually heard of this medication before, but it was used at the very beginning of the pandemic. So this medication can lower seizure threshold. But as time goes on, when we actually shift from one medication to another, okay, for example, you would have heard about things like remdesivir, favipiravir, which is the antivirus medication, which already now actually phasing out as well. Or those medications, for example, the tocilizumab, bortezomib, or even the steroids that we use for patients with very bad inflammation or complications from COVID-19, these medication has no effect on the medication that people with epilepsy is taking. So there's no worry that it will actually increase the effect of the medication or reduce the effect of the medication. So they are safe to be taken together. All right. So moving on to my second half of the talk, which again now we are also not to, this term is actually not an alien term to us anymore when we talk about these COVID-19 vaccines, but putting it on to epilepsy patients, I'm sure the public, you may actually have people around you with epilepsy who actually still have doubts about taking these COVID-19 vaccines, or be it the COVID-19 booster vaccines as well. Right. Okay, so when the vaccine first came out for adults only, okay, we have a lot of patients comes in asking us whether or not they can get vaccinated, and if so, which brand is actually better. So by now we already know that, you know, everybody should get vaccinated. Everybody should get vaccinated. So you have epilepsy, you don't have epilepsy, we encourage everybody to get vaccinated. Which brand is better than the other? So technically for us, the thing that we are looking at is more of protection against severe form of COVID-19 infections. All right. We don't have a you know, head-to-head comparison sort of thing. You compare Pfizer and also you compare AstraZeneca, which one is better? Not really. They are all the same if you ask us. All right, so as long as you get vaccinated, you have some form of protection against a very severe form of COVID-19 infection, we are happy. All right, so the chart below basically just showing you all the brands that were actually available. And in Malaysia, I think by now you'll know that we have a lot of Pfizer, Sinovac, we have a lot of AstraZeneca as well. Okay, and so after they get injected with 2 doses of vaccines, then the question now comes that, well, should I get a 3rd dose? Should I get a booster dose? And if I have the first 2 doses are AstraZeneca, is it okay if I actually get Pfizer? All right. So again, we encourage everybody to get a booster vaccines. And again, for us, if you ask doctors, you mix different brands that are totally okay. That is totally okay for us. Okay. Again, the concept is as long as you get vaccinated and you get certain protection and prevent you from getting a very severe infection, right? And all these are basically guidelines that I get it from Kementerian Kesihatan Malaysia, that when is timing for booster dose. But looking at the situation now, actually, I'm sure that even if you're not at the 3 months, if you're considered a high risk, we'll vaccinate these people as well, regardless of the interval. And not too long ago, I think, so the KKM actually launched the PIC-A, which is the program immunisasi for COVID in Kebangsaan for adolescent. All right, and we got a very good response. And again, if you have teenagers with epilepsy, which we have a lot, those who are in you know, they are 15 years old, 16 years old, 17 years old, can they get vaccinated if they have epilepsy? So the answer actually is yes, and it's also the same as adults as well. all the brands are safe for the teenagers, even if they have actually epilepsy. And just this month, KKM actually launched the COVID-19 vaccines for kids, okay, 5 years old to 12 years old. And of course, now the KKM only approved Pfizer for the vaccines, but pediatric patients with epilepsy can also get COVID-19, and it actually follows the dose and also the interval as any other kids without epilepsy. We usually just inject them with 10 micrograms, lower dose, 1/3 of the dose that we get. And we actually stretch the interval from the first and also the second dose a little bit longer compared to the adults one, but it's safe, okay? And can pregnant, we have epilepsy patients who actually are pregnant also, who are breastfeeding as well. So can they get COVID-19 infections, all right? Of course, yes, it follows other non-epilepsy population as well, all right? They can get Pfizer, they can get AZ, they can get Sinovac as well, but if you're pregnant, then the durations that we encourage you to get vaccinated is between 14 to 33 weeks. If you're breastfeeding mom, totally no issues at all for the patient to get vaccinated, right? And the next thing is, are people with epilepsy at higher risk of developing side effects? Answer is no, okay? If a person can get things like, muscle ache, fever, a little bit of vomiting, giddiness, headache from the COVID-19 vaccines, a person without epilepsy can get the same side effects, but definitely not more severe. They are not at higher risk of getting more severe side effects. All right. And we get a lot of these questions from our patients, as in when they go for, if they have epilepsy and they go for COVID-19 vaccines, will the seizure worsen? All right. So if you're looking at that relationship between COVID-19 vaccines and epilepsy, all right, the seizure control should not be affected at all by the COVID-19 vaccine itself, all right? But if you develop reactions, for example, fever, all right, for example, you got muscle ache and then and then didn't get enough sleep, you will feel stressful, and all these things is the reason why the patient will get seizures after the vaccine. All right, it's a reactions to the vaccine rather than directly related to the vaccine itself. Okay, so by then, what we will actually advise our patient is that go ahead, continue with all the medication that you are taking before and after the vaccines. Don't need to stop anything. If you are taking 2 medications in the morning usually go ahead and take that before your vaccinations. And if you're the type that we usually encourage them to actually take medications to prevent them from getting fever and muscle ache, we'll advise them to take Panadol or paracetamol and sort of thing. And then the night before, just relax, nothing to worry about, get enough sleep before and also after the vaccination. So in all the ways, trying to reduce the risk of them who actually get seizures after the vaccine, right? Okay, so and the last but not least about my slide is about this COVID vaccines causing seizure, and in the future, if the seizure doesn't stop, does it actually cause epilepsy? If you were to look at the professional in our evidence so far, in our literature, if you're going to look up in Google and sort of thing, you will actually find here and there some reports saying that, a person being vaccinated, a certain brand, and they get seizures and then they get epilepsy. All right, but these are just, 1 or 2 cases somewhere in the world at one corner and the other one. We cannot confidently say that the COVID-19 vaccine, with this evidence, we cannot say that, COVID-19 vaccines can cause epilepsy, but definitely we shouldn't ignore this evidence. When things are actually more solid, then I'm sure that the international guidelines will actually come out and trying to inform us what we should know concerning about the safety of these vaccines. But at the moment, we do not have evidence to say that, the vaccine can actually cause epilepsy. All right. And I guess that's about my talk, and I hope by now every one of y'all has already get your vaccines, or if not booster vaccine dose, wear your mask, and also wash your hands very frequently. With a surge in number of cases, I'm sure everybody don't want to get this very nasty COVID-19 infection. Okay, thank you very much.